Hello everyone, and welcome to CRPS Contender, my complex regional pain syndrome education channel. Today's video is CRPS on a shoestring budget, an integrative approach. I am covering a lot of varied content in this video, and it is quite long, so I have included timestamps in the description below, but also remember, if it's getting a bit too much for you and you're losing your concentration and focus, go ahead and hit pause, take a brain break. I'll still be here when you get back. This video is going to be quite a bit different than the prior videos I have produced on this channel, and the content is subjective. Please note that this is not to be taken in lieu of medical advice, but they are definitely things you could talk to your doctor about if you have a doctor that is able to help you. If this is something you would like to further research on your own, I have 5 pages of links in the descriptions, almost 150 sources, so if you want to research this further on your own from someone who's a bit more credible than a random YouTuber making their 10th video, that is all there compiled for you at the bottom. I tried to keep a good range of academic papers versus general articles versus videos, so there should be something for everybody in there. In this video, I will be discussing methods that I have personally used to treat my CRPS. I will not be discussing all methods of treatment. This is only things that I have used and found effective. So this is not completely comprehensive. It is subjective. These methods might not work for everyone, but I did want to put them out there so that if you are just starting down your CRPS journey, or if you are just absolutely at your wit's end, these are things that you can try to see what works for you. Take and leave pieces, that's totally fine. This is here to help you find what will work for you, and not all things work for everybody, and that's totally okay. But I just wanted to put out into the public arena what I have found to be the most effective, efficient, and affordable methods of treating CRPS. This video will also be a bit different in that I will be kind of talking about myself a little bit, because I feel like that background is sort of necessary for this video to make sense. I also want to state that while this channel is educational, it is also therapeutic for me. And so I'm trying to find the balance here of being real, being open and honest about what CRPS is actually like for me. But also I'm a pretty private individual, and I do not really like putting my suffering on display. So I'm trying to find a balance here, which I don't know that I will be satisfied with, but just know this is going to be quite different than the videos I have put out in the past. When discussing these methods, they will basically just be short introductory clips. I do plan on taking each of these methods individually in future videos, going more in depth on each of them. So just know I'm not being even comprehensive in the stuff that I'm talking about. This is just so that everything is in one place, and future videos will hold more detailed information. The methods I will be discussing in this video are things I have found effective, efficient, and affordable, meaning that I have found that they successfully increase my quality of life with minimal waste of time and energy, and are all within restricted financial means, things that could be done on a budget. With that bit of housekeeping out of the way, let's move on to some definitions that are going to be important before discussing methods. What is trauma? Trauma is any event perceived by our nervous system as life-threatening, either to ourselves or to someone else. Trauma is overwhelming stress that exceeds one's ability to cope. Trauma is the inability to integrate our emotions involved in a particular experience. Trauma produces a diminished sense of self and the ability to feel the broad spectrum of emotions and their varying intensities. In short, trauma is anything that is too big for the mind to process. This could be physical. This could be psychological. There does not need to be some huge, massive, devastating event to be traumatic. Anything that is unable to be fully processed by the mind can be traumatic. Now, what is the solution to trauma? In my opinion, that's integration. Integration is the ability to combine one thing with another into a single unit. It is the ability to blend things into a functional, unified whole, and to bring into equal participation. Integrative medicine is a holistic medical discipline. Finally, I want to define holistic because there are a couple different groups that use this term that in practice look quite different. First, I do not mean anything that is anti-science, anti-evidence, or anti-medicine. Holistic treatment is treatment of the whole person, taking into account mental and social factors rather than just the symptoms of a disease. Holistic treatment is characterized by the comprehensions of the parts of something that are intimately interconnected and explicable only by reference to the whole unit. Holistic treatment is a full-body approach to increasing the quality of life and the ability to cope with one's circumstances. In case you need a quick refresher on what CRPS is. CRPS is a severe immunoneurological disorder, which means your immune system attacks and degrades your nervous system structures. Because your nervous system runs throughout the entirety of your body, this disease affects most of your bodily systems and causes extreme burning pain. As a result, the quality of life and proper organism function of a person affected with CRPS is greatly reduced, which means they are often unable to work or have a very limited ability to work, or they really shouldn't be working, but they have to because you need money to survive in our current society. This often means that people with CRPS are on a very limited income and budgeting and may or may not have access to insurance. Before I get any further, if you have the ability, if you're an American, to get on your state's Medicaid plan, you should do that. CRPS is a lifelong condition and there is no cure for it yet, and you will need constant medical care. That's just the way it is. So if you do not have insurance right now, or if your insurance makes it so that you really aren't able to go to the doctors, you should try to do what you can to get insurance that will allow you to get the medical care that you need. Due to the rarity of this disorder, the lack of knowledge about it in the medical field, and the limited funds or insurance from CRPS patients, it is often very, very difficult to get the help that is necessary to receive effective medical care or diagnosis. Personally, in my CRPS diagnosis journey, I have seen 28 different practitioners. This is people with graduate degrees. I am not counting staff. I am not counting nurses. I am only talking about providers, actual healthcare providers who can write prescriptions. I did not get any sort of true help until provider number 24. That is the kind of thing you are up against when you are dealing with CRPS. And then, once you finally do get diagnosed, you're told there is no cure, few effective treatment options, and most of the ones that are the most helpful are often very expensive and not covered by insurance. And yet, the care is absolutely necessary because those who don't get the care that they need at least seriously consider suicide even if they don't commit it. And I'm not gonna lie to you, that was me. Hi, I'm ready to die. Before CRPS, I was a extremely type A individual, a driven perfectionist, and an independent nomad. And then I re-injured an injury I had had as a child. And it was pain. And so I would ignore the sensations as best I could, but over time they became stronger. And the more I would ignore them, the stronger they would become. And my pain tolerance would of course grow in response, and then my pain would grow to exceed it. And I did that for years. And then, eventually, the cognitive dysfunction all piled on at once. Now I had been slowly getting to that point, but truly there was, within just a period of a few weeks, my self-identity was absolutely shattered. I went from being able to very easily read 200,000 words a day to being lucky to read 3,000. I could not do simple single-digit addition. My hands had a constant, severe Parkinsonian tremor, and I was dropping things, and I could not play any of my instruments. I could not find words that I wanted or really speak in complete coherent sentences. I could be in the middle of a conversation with someone, and then suddenly I could not understand what they were telling me. Literally in the middle of a conversation where I just could not understand what they were saying. I'm not going to get into all the specifics, but I do kind of want to paint a picture for you here of how severely my life was affected by this. all of my plans for my future, everything I wanted to accomplish, all of my concepts of myself were utterly destroyed. All of my efforts to get back what I had lost were not enough to return it to me, and the sheer determination to disregard what my nervous system was telling me was not enough to make my body function properly. CRPS dominated every single aspect of my life, and again, I'm kind of trying to paint a broad picture for you here a bit, but it was a wretchedness beyond words, and I could sit here and talk for hours and hours and hours and never be able to convey what it's like. Only sheer obstinance kept me from killing myself for over half a year. These dark months left me constantly traumatized in a continual state of distress. In response to trauma, we fall into survival patterns that we learn in childhood. And there were two major patterns that I learned in childhood: pride and dissociation. Due to my pride, I refused to acknowledge any sort of pain, diminishment, or limitations of my abilities, and I refused to accept help from the people who care about me because I thought it would make me weak and unworthy. And so instead I just dissociated. I altered my level of consciousness and became less present in the world around me, known as derealization, and I detached from the sensations of my body, known as depersonalization. This is something I learned in childhood, and I am very good at it. I would consider myself a master level dissociator, but that wasn't enough. My pain would grow and grow and grow, and the barrier that I erected was constantly breaking and being reinforced as I refused to integrate my experiences, until I eventually reached the point where I had one of two settings. I was a little clay doll without emotions, and only a few programmed responses, and no sensations except pain. And then the barrier would break, and all those sensations would come rushing in, and a switch would flip, and I would be nothing but flaming ropes of nervous tissue with irrational, highly aggressive responses. Every single sensation was pain. I had no hope whatsoever and no joy in life. And I realized that this path, this method of dealing with it, of truly refusing to deal with it, was unsustainable. And I decided something had to change. I either needed to get better or just kill myself and be done with it. Because what was the point of continuing on if every single moment was agony? And I would like to share some of the things I have learned with you now. The first step is personal responsibility. At the end of the day, you are responsible for your own health, and so you need to be proactive about it. Even if your doctors can't or won't help you for whatever reason, you can learn how to help yourself. But first, you need to know what's wrong, so you need to educate yourself. This will also help reduce your trauma. Remember, trauma is anything that is too big to process, and if you don't know what's going on, how can you ever process it? Once you know what's happening, it becomes a lot less scary. It becomes understandable and a thing that you can process. And so right away, it becomes less traumatic. Now, it will not entirely remove trauma from your life, but it will reduce it. I want to state again that these things I am about to discuss are treatment options to improve the quality of life, and they are not cures. There is no cure right now. These are lifestyle changes, and they are most effective if they are used on a daily basis. Most of these can be done independently without needing a prescription or a diagnosis even. Before we get into any of the actual methods, I want to talk about the best gift that you can offer yourself, the gift of self-discipline. Through self-discipline comes freedom and spontaneity. Self-discipline is a learned pattern of behavior and a skill that grows with you, which means it develops over time and requires daily practice. Self-discipline is the ability to take action regardless of your emotional or physical state. Self-discipline is choosing between what you want now and what you want most. Without self-discipline, there can be no self-transformation, and your future depends on what you do in the present. Okay, that's great, but what is self-discipline? What does it actually consist of? I think there are 5 major pillars of self-discipline: acceptance, determination, willpower, dedication, and perseverance. Let's talk about acceptance first. Acceptance is neutrally observing what is without judgment. It is embracing all facets of the self, seeing all your attributes as they are, whether positive or negative, and acknowledging that reality. Maybe what you're experiencing isn't fair, but it is what it is. Acceptance means cultivating self-compassion. Determination is firmness of purpose. It's setting a goal and deciding what you will and will not do to achieve that goal. Willpower is the spearhead of self-discipline, a concentration of force. This is a temporary but powerful burst of energy and focus. This is what you use to set a course and then engage in that course of action. Dedication is the willingness to expend time and energy for a purpose. It's commitment to an end or a goal, and putting in the time where it's needed, in spite of your feelings. This is the willingness to repeat patterns. Finally, perseverance. This means continuing in a course of action without regard for discouragement, opposition, or previous failure. This is stamina and endurance in a time of struggle. Now that the base work of responsibility and self-discipline has been discussed, we can talk about individual integration, a nervous system at war with itself. What are the core human needs? To be seen, to be heard, to be authentically expressed. I want you to remember those because we're going to come back to them later. In my experience, humans have two major understandings of the world. I do this, and this is done to me. These concepts are very important for the rest of this video, so I am going to give several different conceptual terms that are all slightly different from each other, but at the end of the day, I think are really trying to talk about the same thing. So, if we kind of come from different perspectives and your outlook on the world is different from mine, I want to be able to make this broad and work in the framework of however it is you view the world. So, again, these are all slightly different terms, but at the end of the day, I really do think they're basically trying to talk about the same thing. So first, let's talk about the nervous system. I do this, that's your somatic nervous system, what you actively control. This is done to me would be your autonomic nervous system. Voluntary control versus involuntary control. Conscious behavior versus unconscious behavior or subconscious behavior or superconscious behavior. Spotlight attention, this is what I'm focusing on here, directly in front of me and nothing else is important, versus your floodlight attention, where everything is brought. This is what you see but don't notice. In terms of Western psychology, I do this would be the ego. This is done to me would be the higher self. In Abrahamic religions like Christianity, Judaism, and Islam, this would be the difference between the spirit and the soul. In Hinduism, this would be Ahamkara versus the Atman. In Buddhism, this would be the difference between Atta and Anatta. And in ego work, this would be the difference between the storyteller and the witness. We often identify ourselves as our conscious behavior. This is shown in our language. I move my hand, I speak, I squat. But we often do not identify ourselves as our unconscious behavior. This is also shown in our language. We say, my heart is beating, not I beat my heart. My pupils contract, not I contract my pupils. My blood vessels expand, not I expand my blood vessels. Despite our arbitrary decision to identify ourselves with one system and not the other in this manner, we are in fact both systems simultaneously working together in one complete unit. CRPS attacks the autonomic nervous system. And so in response, when we try to split our brains into separate units and dissociate from parts of ourselves to divorce ourselves from our pain, we refuse to see what's happening. We refuse to look at it, we refuse to hear it, and we refuse to let it express itself as it is. We refuse to meet the core human needs for ourselves. And in doing so, we think we're helping ourselves or fixing our problems, but we aren't. In CRPS, the pain is a result of your nervous system being harmed and degraded. If you try to separate yourself from your own nervous system, it won't work. Because it's you. When you attack it or divorce yourself from it, you are only attacking and divorcing yourself. The pain will still be there because it's part of you. It is you, the entire state of your nervous system. The first thing I could tell you to do is to accept it. See it for what it is. Look at it in all its horror and all its terror, and realize it isn't so scary after all. Your autonomic nervous system is not your enemy. It is just you. So don't waste exorbitant amounts of energy in self-defense, because it won't be effective and you won't have any energy left for anything else. Energy is a very precious resource to people with CRPS. Do not squander it beating yourself up. CRPS can cause severe feelings of shame and self-loathing as your body and brain defy your conscious control. Sometimes things just happen, and we have to deal with it as it is, not as we want it to be. This is not to say to give up and to roll over and just never do anything to better your situation. Not that at all. Keep striving, keep contending, move forward with determination and dedication and discipline. But know that some things cannot be changed. CRPS is one of them, because we do not have a cure for it. What cannot be changed must be accepted. You can improve your situation, and you can integrate your nervous system into a whole unit. But first you need to accept yourself as you are. You need to see your nervous system for what it is, listen to what it's saying, and let it express itself as it is. Pain is here to stay. You can be its enemy, or you can be its friend. I encourage you to become its friend and embrace yourself. Part of embracing yourself and accepting yourself as you are is realizing that your brain has some serious problems. CRPS causes many emotional, behavioral, mood, and instinctual changes via limbic system dysfunction and neurodegeneration. This presents itself in symptoms very similar to bipolar disorder or dementia. Our emotions are activated to elicit some sort of survival behavior. In CRPS, you are living in a state of constant trauma because your nervous system is being attacked. This sends your environment emotion appraisal into overdrive. This means that feelings of rage, terror, loathing, grief, and amazement are exacerbated. This can be very overwhelming and cause you to lose conscious control over your behavior. These irrational behaviors are driven by your life-threatening disease, severe emotional distress, and cognitive dysfunction. Your midbrain propels extreme reactions to survive. This is totally understandable. But long term, it is not sustainable. So you need to find another method to deal with it. What I have found to be very helpful is mindfulness meditation. The goal of meditation is to create psychological space for yourself, to allow yourself to respond rather than just reacting impulsively. There is a fair deal of misconception about meditation. What I mean by meditation is not the emptying of your mind and thinking of nothing. That is not at all what I mean. We are simply watching the breath in and out, and in and out. This creates space and allows your emotions to exist and be acknowledged without them controlling you. This allows you to see the sensation for what it is and let and tell you what it wants to say and be as it is, with you acknowledging it and looking at it, and then you can just let it filter away without it controlling you and continue on with what you were doing. This is a discipline that requires practice, but it can be done anytime, anywhere. If you're awake, you can meditate no matter what else you're doing. The next broad category I want to talk about is nervous system integration. Before we can get into that, we need to talk about reflexes. A reflex is a conscious or unconscious behavior that occurs in response to a change. As humans, we have all different kinds of reflexes. There is one particular group known as primitive reflexes, and these are the building blocks of development, and they myelinate your brain circuitry. Remember, myelination is the fatty substance that wraps around nervous tissue that makes sensations and signals go fast. Primitive reflexes are involuntary physical reactions to specific stimuli that occur in the brainstem. Primitive reflexes are present during the first few months of life, but they are not present in neurologically intact adults. As we grow up, Primitive reflexes are fully integrated and are able to be used in little bits and pieces in their increasingly complex and voluntarily controlled replacements known as the postural reflexes. If you retain a primitive reflex, which means it is not fully integrated, there are far-reaching consequences that impede all kinds of subsequent behavior and action patterns. The goal of reflex integration is to set the foundation to rights, so that more complex and controlled behaviors can occur. The way we do this is by physically enacting the reflex and allowing the body to relearn it properly. The first reflex I want to talk about actually isn't even present by the time you're born. This reflex is known as fear paralysis. Unlike the other reflexes, fear paralysis is the deepest response that we have. It is associated with actions of attachment, security, settling, and the meeting of basic needs. Fear paralysis is a withdrawal reflex that emerges in the embryonic stage. It should be fully integrated before birth, and it changes into the Moro reflex, which I will talk about on the next slide. This happens about week 12 of gestation. This is the reflex that deals with dissociation and then turns into your fight or flight responses. The fear paralysis reflex responds to stress and stimulation by freezing and withdrawing. It is thought to be the first step in learning to cope with stress. A reaction at this deep level is often subconscious, and it governs and controls behavior and emotional responses to the point where the person who is experiencing a fear paralysis reflex is not interested in interacting with the outside world. The needs and interests in engaging are blocked. When it is unintegrated, you can deal with things like over or under attachment, compulsive traits, an exaggerated need for routines, anxiety, elective mutism, touch withdrawal, sleep or eating disorders, depression, extreme shyness, perfectionism, controlling behavior, phobias, low stress tolerance, and separation anxiety. Now, there are more than this, but these are just some of the major ones that I think would be prominent for most people. The fear paralysis turns into the Moro reflex, also known as the startle reaction. This is the only other reflex I am going to get into specifically, but there are several, and I will do a video discussing them in more detail later. But just due to the dissociative and sympathetic responses of fear paralysis, which becomes the startle reaction, I did want to discuss these in this particular video in a bit more depth. Moro reflex can also be known as the startle reaction, the startle response, or the embrace reflex. This is believed to be the only unlearned fear in human newborns. This is your earliest form of flight or flight, which is a reaction to stress. During the Moro reflex, you will notice the arms and legs extending up and out, and then quickly being pulled into the torso as the hands clench. In an adult, you might notice this as, say, some loud noise spooks you and startles you. Your head and spine straighten and your shoulders pull back, and then you kind of curl in slightly, your hands come in front of you, and your fists clench. That would be a Moro reflex in an adult. This is brought on by sudden shifts in the head location, temperature changes, or loud noises. There are two coping mechanisms in response to this reflex being activated: withdrawing or becoming aggressive. When this response is unintegrated, you experience free-floating anxiety, an excessive reaction to stimuli, difficulty making decisions, a weak, fragile ego, and low self-esteem. To work on reintegrating this reflex, there's actually a couple different positions, but I want to talk about the one where you're lying on your back. So lie on your back on the ground or a nice flat surface. And you're going to have the soles of your feet touching each other so that your knees are out and bent a bit. And then you're going to have your arms raised above your head. Then you are going to curl in so that your feet are basically over your groin area and your knees are in between your waist and your rib cage. At the same time, you are going to curl the upper part of your body so that your arms bend and come forward, and they will be crossed at the wrist, really more in the forearm area, so that each hand is touching a collarbone and each elbow is touching a knee. You are using your core muscles to hold this pose. You're going to hold that for about 7 seconds. And then you're going to gently release so that your arms and legs go back to their original starting position. And you're going to do that for a total of 3 to 5 times. And then that's it. Then you can be done. And it's best if you do that every day to help reintegrate that reflex. So maybe some of what I just talked about resonates with you. Like, yeah, I do think my moral reflex is unintegrated, and so how do I reintegrate it? How do I make it so that it stops causing a problem for me? Well, the method I would like to recommend is known as MNRI, which is an acronym for the Maskatova Neurosensory Motor Reflex Integration Method, which was developed by Dr. Maskatova in Russia in 1989. Although the knowledge contained in this method spans a century, a variety of disciplines, and many notable researchers, scientists, psychologists, and physiologists. Due to the upheaval of the 20th century and much of the research being both written in Russia and written in Russian, Western scholars lacked access to this information and evidence. And indeed, a lack of translated scientific material impedes further progress to this day. Now, this slide in no way is meant to talk about the entirety of this method. If you want to learn more about it or see what some of the backing science is behind it, I have included several links to this website directly, so you can go look at that for yourself. If you have access to a physical therapist, I highly recommend searching for an MNRI trained physical therapist who can assist you. MNRI is a very low impact passive form of physical therapy that focuses primarily on supporting the integration process of the primary motor reflex patterns regardless of a person's age or condition by targeting the underlying neurosensory motor mechanisms. Some of this needs to be done with someone who is trained in how to do it. However, a good deal of it can be done on your own at home, as long as you know what to do. There are 3 different categories of patterns. There are 8 archetype movements, 8 primary motor reflex patterns, and 7 additional motor reflexes that are targeted by this method. I tried to find a good YouTube video of at least the archetypes by themselves being displayed, and I was unable to find one, so at some point I will probably try to create one just so that it's all here in one easy to find spot. But there is for sure at least a poster that explains them that I've linked in there as well, so you can look that up if you need to. I swear by this method. Beyond meditation, I would say this has been the most helpful thing for me. It has really given me some control over my coordination and bodily functions again, and has greatly increased my cognitive ability. I do this for at least an hour every single day, sometimes multiple times throughout the day. But before I go to bed, I have a mashup routine that consists of meditation, MNRI, and yoga. And I do that right before I go to bed. And if for some reason I was unable to complete it, or didn't get all the way through it, and maybe I only did a quarter, or I only did half, I can tell within 1 to 3 hours of waking up because my cognitive decline is so severe and my body just starts malfunctioning in an extreme way. This is something that needs to be done every day. Once the reflex pattern is reintegrated, it doesn't become unintegrated again for many different kinds of diseases or disorders. That is not the case with CRPS, and I'm going to tell you why. Because CRPS continually tries to attack your nervous system, which means all the progress that you make with the MNRI method, the CRPS is constantly trying to undo, and the CRPS doesn't stop and it doesn't sleep. So you have to constantly be redoing what you have done so that you don't lose ground. And that is something I want to make very, very clear. These methods need to be done continuously. Not just this, but all of them. Because your CRPS is not going to give you a break. So you need to be more disciplined and dedicated than the CRPS is. The next method I want to talk about is spinal cord stimulation. Now, this is not a spinal cord stimulator or a dorsal root ganglion stimulator, but the concept is based in the same root. I have not used either of those methods. I'm not going to discuss them here. This is manual spinal cord stimulation. Your dorsal root ganglion carries sensory information to the spinal cord. Your ventral root ganglion carries motor information out of the spinal cord. Your sensory function of the spinal cord is completely dependent on your dorsal root ganglion. Now, if you watched any of my autoinflammation and autoimmunity miniseries episodes, you will note that one of the 5 major dysfunctions, according to Russo's hypothesis, is dorsal root ganglion dysfunction. So the goal here is to stimulate it. You have 1 dorsal root per spinal nerve, which means you have 31 left and right pairs, and this is protected by your spine. Your dorsal root ganglia is responsible for your perception of pain and mechanical stimuli. These are first-order neurons, which carry stimulation from your peripheral nervous system, out in your body to your spinal cord of the central nervous system. This is responsible for feeling things like heat and cold, crude or fine touch, vibration, pressure, and pain. And it is the sensory component of your reflex arcs. When inflamed, your dorsal root ganglia are overexcited and increase your pain threat receptor signaling. So the goal here is to kind of help soothe them and encourage them to function in a more normalized manner. We are trying to stimulate and integrate your DRG and your spinal cord via firm flowing pressure up and down either side of the spinal cord. This is to assist with remyelination and proper signaling. So the way you're going to want to do this is start at the base of your spine by your sacrum or your tailbone and take either the backs of your fingers, kind of make a fist so that your second knuckle is kind of pointed, or you could use your thumb. Either way, you're trying to get a nice solid point here. When you feel your spine, you can feel the actual bone there, right in the center. And then if you go out to the side a little bit on either side, you'll feel the muscles in your back that hold you upright. You're trying to get right in between those 2 areas, that groove, in between the rough lump of muscle and the hard point of spine. And right in there is where you are trying to put your fingers. And you are going to do both sides at the same time if you can, but if you can only do one at a time, that's fine. Just make sure you do both sides, even if you're only doing one at a time. And you're going to take some firm moving pressure and just run up from your sacrum as far as you can reach up your back. And then you're going to kind of gently go out to the side and then stop. And then you can also do this the other direction. You can either start at the root of your neck, where your skull becomes your neck, or you can start kind of where your neck becomes your shoulders. If you have someone who is willing to assist you with this, that's actually way easier to let someone else do this to you. But if you're on your own and you need to do it to yourself, it's a good way. You can go bottom to top or top to bottom. We're trying to just make the sensations, the stimuli, run up to the brain and then run down from the brain out into the body, and we're trying to encourage that to work in a programmed manner. You can do that between 3 and 7 times and then be done. Originally, when you start this, you might notice that your back kind of hurts a little bit. That's understandable. That should stop after several times, like several days of doing it, and you should be kind of done with that. The next thing I want to discuss is cerebrospinal fluid circulation. Now, cerebrospinal fluid is a clear, colorless fluid in the brain and spinal cord. You have about 500 milliliters that you produce per day, but there's only about 150 to 250 milliliters present in your body at a time. This is an ultrafiltrate of blood plasma. Its function is to work as a shock absorber and a weight reducer, and to help your brain retain its shape. When your brain is removed from your cerebrospinal fluid, it weighs about 1,400 grams. But when it is in it, it only weighs about 50 grams. Your cerebrospinal fluid bathes your central nervous system in nutrients and chemicals that are filtered from the blood. It helps remove brain waste, and it works as the immune system of your central nervous system. CRPS causes neuroinflammation and brain swelling, which increases the blood pressure inside your skull. And this is exerted on nervous tissue via the fluids in your head, including cerebrospinal fluid. Cerebrospinal fluid might have a very important role in brain regeneration during sleep, as well as neurodegenerative and immunological diseases of the brain. The goal of cerebrospinal fluid circulation is to encourage it to move via gentle flowing pollen at your sacrum and the root of your cervical spine. If you don't know where that is and you need to look up a picture or an image of the spine and what the vertebrae are labeled, this is going to be at your sacrum. This is going to be your L5-S1 joint, and at your cervical spine, this is going to be the C7 at T1. So basically what you're kind of going to want to do is you can either do this on your stomach or on your back, whichever is easiest for you. But I want you to kind of imagine that you're holding a shoestring, and imagine the kind of elasticity of a shoestring. There's not a lot of give, but there is a little bit. That's kind of what I want you to imagine when you're holding. Before I tell you what to do, I want you to think of your cerebrospinal fluid like this. You have a clear hose that is filled with water. Okay, and it's completely filled. The water's in there, but there's enough of a gap that you can kind of see that the water is moving. As long as if you were to flip it round and round and round, the water would move in the tube. The goal here is to try and get that water to move, except it is attached to the back of a suitcase that is filled with rocks. So you can't just wiggle it and shake it, because you'd have to wiggle and shake the entire suitcase to make that happen. That is kind of what we're trying to do here with your cerebrospinal fluid, is just encourage it to keep moving, to not get stuck, to not stop, to not be in stasis. You want it to continually circulate so that pressure doesn't build up and so that waste is removed and your brain is given the nutrients that it needs. The way we're going to do this, going back to holding the shoestring, put your hand right at the base of your neck where it becomes your shoulders, and right at the base of your spine where your lumbar spine becomes your sacrum. And you're just going to sit there. Let's pretend you're on your back. Okay, your hands are in spot. You'll probably need your hands facing opposite directions, with the one on your back facing upward with palm towards the ceiling, and the one below your sacrum palm down facing the floor, unless you're super flexible. But I found that's kind of the best method for me anyway. And you're just going to sit there for a little bit, because you want to figure out what your natural body rhythms are. Give it 30, 60 seconds, however long it takes for you to feel whatever your natural body rhythms are. Maybe you align with your heartbeat. Maybe you feel the blood flowing through your circulatory system. Maybe it's as you inhale and exhale that you can kind of feel things moving around in your body. Whatever that is for you, fine. Just pick something. Whatever you best associate with. Perfectly fine. And I want you to pretend that you're still holding that shoestring. It's got a little bit of give to it, but not a lot. Personally, I use it with my breath, so I'm going to use that example. But whatever it is that you're going to run with, put that in place of your breath here. But I use the breath. So, as you inhale, you're going to slightly pull up on the back of your neck. Just slightly. You're going to kind of pull towards your skull. You're not moving a lot. You're not trying to get a ton of motion here, because how hard you work your muscles is not going to make your nervous system work better. Okay, so that is not what we're trying to do. We're not trying to force anything. We're trying to encourage the body to do what it already wants to do. So you're going to just slightly pull towards your skull. You're holding that shoestring and reach the end of the elasticity of it. And so you're going to pull just enough to where your bottom hand moves slightly upwards. You're not trying to move it. You're not moving where it is located on your back. You're just slightly feeling the pull, because your skin has been fully pulled taut. And you exhale, and you kind of relax your upper hand, and your back hand, the low hand by your sacrum, is kind of pulling down, but you're more kind of pulling it up towards your pubic bone. And it'll slightly pull your upper hand down. And then you breathe in again, and you're going to pull up with your hand, which will eventually pull your bottom hand. And then you breathe out, and you're going to pull down with your bottom hand, which will eventually slightly pull down your top hand. And you're going to just do that for a while. You're just trying to encourage that fluid to move. That's it. And then you're done. This is not a huge, hard physical exercise. Very, very, very gentle, almost imperceptible movements. The next method also requires almost imperceptible movements, although these are slightly more intense. This one is trying to stimulate peristalsis. Now that is the digestive action of moving through food through your digestive system. Your myenteric plexus is the major nerve network of the gastrointestinal tract and controls your gastrointestinal motility. The myenteric reflex is a reflexive action of the intestine in which a physical stimulus causes the intestine to contract above and relax below the point of stimulation. CRPS can cause rapid, slowed, or basically non-present peristalsis, causing pain, bloating, cramping, constipation, or diarrhea, as well as a nutrient deficiency. The goal with peristalsis stimulation is to normalize peristalsis function via gentle physical stimulation of the myenteric plexus with circular pressure distribution of the hands at about a nickel weight. So basically what you're gonna want to do here is gently set your hands, both of them, on your stomach, running from pubic bone to just under your diaphragm. You're going to very gently, very, very gently, kind of work in a big rounded rectangle. And you're just gonna slightly move your hands, shifting the pressure. You're not putting a lot of weight on there. Another similar motion is to pretend like your stomach is a face of a clock, and you're going to start on the left side, right about your waist, and using both hands, pull from outside of your waist towards your stomach, one hand right after the other, in separate motions. And then sliding, you're going to move down towards your hip. And once you do there, you're going to move down, pointing towards your iliac crest, and then you're going to be close over near your pubic bone, and then you're going to be right on top of your pubic bone, going round and round and round in little sections around this clock. About 12 is good, but it doesn't really matter what number you're trying to go for there. You're just trying to do it in little segments, starting from the left side, going around to the right, and then over back to the left again. Another thing is to hold your hands flat and taut, and use the tips of your fingers on either side of your body, and you're going to try to get underneath your top layer of fat to stimulate the nervous tissue on top of your intestines. So it's going to kind of feel like you're pulling your fat separate from your organs. And that's really what you're kind of trying to do, but you're not trying to put your fat on display. You're just trying to get underneath of it so that you can get more direct. And you're just going to kind of hold it in there, maybe 3 to 5 seconds, and you're going to pull back and let go, and then you're going to move down a little bit. You're basically kind of starting right below your stomach, and then you're going to work your way down to, if you were to take the tips of your hips and draw a straight line across, so you've got about a palm between your pubic symphysis and that line. You're just going to kind of do that area at once, and then you're done. So you're just trying to get things moving in there so that you can properly digest your food. Now we're going to move away from neural integration and into musculoskeletal integration. But we're going to first talk about neurotransmitters. Neurotransmitters are chemical messengers of the nervous system, and they send signals to either other neurons, muscle cells, or gland cells. There are 3 main kinds of neurotransmitters: excitatory, inhibitory, and modulatory. Excitatory neurotransmitters increase the likelihood that a neuron will fire. Now remember, a neuron only has 2 options, on or off. That's it. Excitatory neurotransmitters are things like epinephrine or norepinephrine. And then you have your inhibitory neurotransmitters. These are neurotransmitters that will decrease the likelihood that a neuron will fire. These are things like serotonin or dopamine. And then you have your modulatory neurotransmitters, which affect many neurons at a time, and they are much slower, but have a broader range of reach and can affect other chemical messengers as well. There are a couple major kinds of neurotransmitters: amino acids, peptides, monoamines, purines, gasotransmitters, and acetylcholine. The goal of neurotransmitter re-education is to improve movement disorders as well as mood and cognitive function. Say your ankle is very weak. This would be things like moving your ankle in a controlled circle so that you are teaching your body exactly what you want it to do. Or maybe arch support, where you need to pick up marbles with your toes. Or maybe working on your hip abductors and to work on holding your bones in place. Those kinds of things would be, in this sense, neurotransmitter re-education. This is not talking about a lack of serotonin causing depression or anything like that. This would be more physical rather than psychological again, a physical therapist, if you have access to one, would be particularly helpful with this. Next one I want to discuss is aquatic therapy or exercise. Water is excellent because it offers both resistance and support in a safe, soothing environment. This allows for exercise without actually having to hold the entire weight of your body, and it reduces the effects of gravity during motion. So if you are experiencing joint pain or real muscle weakness, this is a great place to get back in the swing of things. This can be used in coordination with land-based therapies or exercises. The goal here is to improve balance, flexibility, and coordination, assist with gait and movement, increase aerobic capacity, and increase strength and endurance while reducing stress and promoting relaxation. If you don't have a pool or access to a pool, but you do have access to a YMCA, the YMCA is a fantastic place that usually does have some sort of indoor pool, some locations, as well as offering group exercise classes. They also have lower monthly rates for people experiencing financial difficulties. So if you can't afford the membership fee, you could go and see what kind of discount they are willing to offer to those experiencing hardship for whether that's financial or medical reasons. They are usually quite willing to meet you somewhere so that you can still utilize their facilities. Next one I want to discuss is heat therapy. Now there are two kinds of heat therapy, moist heat and dry heat. These would be things like hot tubs or a warm bath, a hot pad, a warm towel, a hot water bottle. Heat is used to reduce pain, relax soft tissue, increase range of motion, and reduce stress. It is meant to increase circulation, which will increase the speed of oxygen and nutrient delivery, as well as waste removal. It will increase the enzyme activity, which will help raise the metabolic rate to increase tissue repair. And stretching during or after heat therapy improves flexibility and joint range of motion. Moist heat I personally find to be much more enjoyable than dry heat, but they both have their benefits and are used in different contexts. Only use heat if it is relieving your pain. If it is causing you distress, stop. Do not use it anymore. There are some CRPS cases that do not tolerate heat at all. If that is you, do not use this. Do not make your situation worse. Do not ever, under any circumstances, use hot and cold therapy. And under no circumstances whatsoever do you ever use ice. Never, ever, ever use ice for CRPS. The next method I want to discuss is stretching. Stretching helps keep muscles strong, flexible, and healthy and prevents muscle wasting. Now, if you are experiencing dystonia, that is the uncontrollable muscle contractions, or you are just not using your muscles and you're constantly tensing because you're in pain, you're probably not going to be able to stretch very far at first. Totally understandable. But you do want to, over time, generally try to increase your flexibility. There are two major kinds of stretching, static and dynamic holds. A static hold is just holding a comfortable stretch for 10 to 30 seconds, and a dynamic hold is a much more flowing stretch where you don't stop and hold it. Long, lean, flexible muscles allow for exertion without putting too much force on the muscle itself. This allows for a reduction in pain and energy expenditure. The goal of stretching is to increase flexibility, range of motion, and blood flow, improve posture and physical performance, reduce stress and muscle tightness and pain, assist in calming the mind, and reduce migraines and back pain. The next method I want to discuss is desensitization. Desensitization is used to modify how sensitive an area is to a particular stimuli. This is done by applying an unpleasant stimuli consistently throughout the day in short bursts. The brain will respond to this by eventually acclimating. Basically, the method here is just get used to it. You're exposing yourself over and over and over again until it's tolerable. The goal here is to inhibit their interpretation of routine stimuli as painful. This does not mean that the stimuli will ever be pleasant, but hopefully it will no longer provoke an extreme pain response. Lymphatic massage is a gentle form of massage that circulates the lymph throughout your body. Now, do not do this if you are dealing with any kind of infection. CRPS patients often suffer from lymphedema, which is swelling from lymph fluid not draining or draining improperly. It is important that anytime you do a lymphatic massage, you're massaging both sides of the body, not just the side with lymphedema. There are 2 stages of the massage: clearing, which works at your lymph nodes, and reabsorption, which works with the area that is experiencing the swelling. The goal with this is to reduce swelling, improve limb mobility, encourage proper lymphatic flow and drainage, and encourage the removal of waste products. Again, if you have access to a physical therapist, this is something they can assist with. Next one I want to discuss is strength training. Specifically functional strength training, which is training that attempts to mimic the specific physiological demands of real-life activities. And you're going to want to start low with this and increase over time. Maybe that means you curl weights every other day. Maybe that means you walk half a mile. Maybe that means you stand up and sit down 10 times a day. Whatever that means for you, this is designed to improve your strength and endurance over time, as well as release endorphins and dopamine and serotonin. The aim here is to increase stamina, muscle tone, bone density, and connective tissue strength, as well as improving metabolic and cardiovascular health, providing a healthy emotional outlet, improving your mood, and a sense of accomplishment. Over time, if you stay consistent with this, especially if done in combination with neural integration, you can start getting your life back. Maybe you couldn't ride a bike anymore, and now you can. Maybe you couldn't play tennis, and now you can play a game before you have to stop. Maybe you couldn't drive your car anymore. Maybe if you have a kid, you couldn't pick your kid up anymore just because it hurt you too much and you were too weak to do it. But with time and integrative training, hey, guess what? Now you can hold your kid for 3 minutes on your hip before you have to put them down. These are the kinds of things, slow, manageable goals that you can reach and feel a sense of accomplishment. The trick here is knowing where your limits are. So you need to figure that out and then use your strength training or whatever training it is. It doesn't necessarily just need to be the strength training, but you need to go right up to your limits without crossing them and stop. And little by little, that limit line will move a bit further away and you can keep inching forward without crossing the line. But look back in a few months and realize, wow, you're actually 6 feet further than where you started. And that's what this is about. Discipline over time. And finally, neuromusculoskeletal integration. Yoga. Yoga is integration in action, and it promotes unity between the body and the brain. This combines strength, stretch, balance, flow, and parasympathetic activity. It encourages being present in the moment and being present in the body. If you decide that you want to try MNRI, you will notice a fair amount of overlap between the yoga poses and the MNRI reflex patterns, which lends itself to being able to create a mashup of whatever patterns you think work best for you, the ones that you need to do. And instead of doing, the kind of standard held MNRI patterns, you can add some flow and create a very moving, soothing routine for yourself, combining MNRI and yoga. There are a range of poses that have varying intensities, so you can create a very malleable routine that is tailored to your changing needs. This encourages a balanced emotional state and a reduction of stress. Again, YMCA offers lots of yoga classes and a membership will give you access to them. If you do not have a membership, I recommend trying to get one if you can, because it will also give you social interaction in a controlled, relaxing setting where you are also focused on your health and can meet with other people who have similar goals. So it can also be a very social thing. Okay, moving away from neuromusculoskeletal integration and into diet. CRPS causes digestive dysfunction via silent inflammation, a hypoactive parasympathetic nervous system, enteric system, and vagus nerve. The food that you ingest determines the behavior of your body, and inflammatory foods exacerbate CRPS while anti-inflammatory foods calm it. This is because CRPS is inflammation of your nervous system. The goal with an anti-inflammatory diet is to reduce intestinal pain, improve digestion, and gather and utilize nutrients. Because CRPS also means you likely have a nutrient deficiency because you are not properly absorbing the food anymore. An anti-inflammatory diet is unlikely to solve all your intestinal dysfunction, but instead create increased autonomy and ability to function, as well as improving mood and balancing emotions and creating more energy. In the same vein as an anti-inflammatory diet, you're going to want to make sure that your nutrient levels are adequate. The first one I want to talk about here is magnesium. Magnesium is the fourth most abundant mineral in the body, and yet up to 68% of people who live in Western civilization get less than the recommended daily intake. Magnesium regulates over 600 diverse biochemical reactions, including energy formation, protein creation, gene maintenance, muscle movement, and neurotransmitter regulation. It plays a critical role in brain function and mood, fights depression, and may assist in reducing depressive symptoms. It lowers the risk of type 2 diabetes, lowers blood sugar levels, and reduces insulin resistance. It lowers the blood pressure in people with elevated levels, but not those with normal levels. It helps fight inflammation and reduces some inflammatory markers, and it may prevent or provide relief for migraines. It also helps improve PMS symptoms, including reducing water retention and improving mood. For people with CRPS, it will assist in increasing appetite, decreasing fatigue, nausea, and weakness, reducing muscle cramps, numbness, and heart rhythm issues. In tablet form, it is recommended that CRPS patients take 500 to 1,000 milligrams daily, which is slightly over double the daily recommended intake for most adults, which is 310 to 420 milligrams daily. But you should take that in divided doses, which means don't take it all at once, take it a couple different times throughout the day, whether that's twice or 3 times, whatever works best for you. The preferred types of magnesium here are magnesium malate or magnesium glycinate. You also should ensure that you have the proper B6 levels for the best absorption, but this is easily obtained through your diet, so no real worries there. You're also going to want to make sure you have your proper levels of B9 and B12. These are water-soluble vitamins that are obtained only through diet or supplements. B9 is a coenzyme that is essential for cell growth, DNA formation, and amino acid metabolism. It is required for the formation of red and white blood cells. The recommended daily intake is about 400 micrograms per day, with an upper limit of 1,000, and it is best if this is obtained through your diet rather than a supplement. B12 is also a coenzyme, and it is crucial to the function of the brain and nervous system. It assists in red blood cell formation, the creation and regulation of DNA, and assists in fatty acid synthesis, energy production, and B9 absorption. How much B12 you can absorb at any given time depends on a protein in your stomach known as intrinsic factor. B12 is absent in plants and is only sourced through animal foods, so if you are a vegan or a vegetarian, make sure you are having a supplement to get your necessary B12. The recommended B12 daily intake is 4.2 micrograms. Vitamin C is the only water-soluble vitamin that isn't in the vitamin B category. Vitamin C boosts immune function and is necessary to synthesize collagen in connective tissue. It is a powerful antioxidant that defends against oxidative stress. All 3 of these things are things that are targeted by CRPS. Vitamin C is mainly found in fruits and vegetables, and there's basically no vitamin C in any cooked animal-sourced food. The recommended daily intake for vitamin C is 60 to 90 milligrams a day with an upper limit of 1,800 milligrams a day. This is more of a daily nutrient thing. There is also a CRPS treatment of taking high-dose vitamin C at the onset of CRPS before you switch from sympathetically maintained pain to sympathetically independent pain. And there is also high-dose CRPS options before and after surgery. I'm not really getting into either of those right now, but both of those exist. Vitamin D is a fat-soluble vitamin that is attained mainly through sunlight or supplementation. Vitamin D helps maintain normal blood levels of calcium and phosphorus. It aids in calcium absorption, promoting strong bone formation and maintenance, and it boosts the immune strength via antibody production. The recommended daily intake of vitamin D is 400 to 800 international units a day. However, CRPS patients may need up to 10,000 international units per day, so that is really quite variable. And then finally here, your omega-3 fatty acids. Omega-3 acids are polyunsaturated fatty acids. There are 3 types of omega-3 fatty acids in human physiology. They are DHA, EPA, and ALA. Omega-3 acids are an important part of mammal breakdown and storage of fats for energy, construction of healthy cell membranes, function of cell receptors, hormone balance, genetic function regulation, blood pressure and heartbeat regulation, and a reduction of inflammation. You're going to want to make sure you are balancing your omega-6 and omega-3 ratio, which should be less than 4:1. Omega-6 is found in refined vegetable oil and processed food. That means often, especially in America, the omega-6 to omega-3 ratio is insane, like completely out of whack. Now, if you do decide to participate in an anti-inflammatory diet where you are removing processed foods from your diet, this will immediately assist in that. There is no agreed upon recommended daily intake. I found actually quite some varying answers, and I'm not quite sure how the math works out with the 4:1. I don't know. I got some wonky numbers here, so I'm going to put this up there, but this is probably something you should definitely talk to your doctor about or research for yourself, because I was not able to get a conclusive answer here. And then finally, I want to talk about reasonable remedies. Medication on a limited income. Again, I'm only discussing medications I have personally used. There are more than this that other people use, and I know they have found them helpful. First, LOPERAMIDE. Generic, this is LOPERAMIDE, but brand name is Imodium. This can be purchased over the counter or via prescription, and it is covered by most U.S. insurance policies. LOPERAMIDE is an antidiarrheal that slows movement in the gut and decreases the number of bowel movements you have in a particular day, as well as decreasing water in stool. This is affordable and good to have on hand. This can be used daily or as needed due to fluctuations in pain or food intake. So maybe you decide, hey, you know what? I don't normally have pizza, but I am really feeling Papa John's today. And so I am going to take a pill or 2 of this and then eat the pizza and know that I'm probably going to be in for a bad time. Or ice cream, or sugar, or whatever it is. Maybe you're just having a high pain day and your gut is not working with you. This would be something that could assist in that. However, I have found that the anti-inflammatory diet really reduces the need for LOPERAMIDE. I really don't take it anymore at all, unless I have eaten something that I know is not going to sit well. However, if the diet or other treatments are unable to assist in reducing or stopping those symptoms, this may be continued in a more long-term way, even though that is not recommended, but it is something that could be done. Next one here is cannabis. Cannabinoids are naturally occurring neurotransmitters in humans. Cannabinoids are potent anti-inflammatory agents that suppress cytokine production and induce T regulatory cells. Remember, the T regulatory cells are the cells that help differentiate you from other, and are cells that CRPS patients have issues with because CRPS is constantly attacking yourself with your immune system. The cannabinoids in cannabis bind to the cannabinoid receptors found in human cell walls. There is a system that has been somewhat recently found in humans called the endocannabinoid system. This system is found throughout the brain and body and regulates a wide variety of processes, including pain, reward, memory, mood, appetite, stress, sleep, metabolism, immune function, and reproductive function. The main purpose of the endocannabinoid system is to maintain bodily homeostasis, which is a biological harmony in response to changes in the environment. Cannabis has multifaceted benefits for pain management. Some of those include a stimulation of appetite and hunger induction, the calming of muscular spasms and movement dysfunction. It counteracts insomnia and migraines. It alters your perception to assist with your relationship to pain, your relationship to other human beings, and your relationship to your own limbic system degeneration. This can assist with the ability to take pleasure in life, and it can reduce your reliance on opioids and even your need to take them. Cannabis is safe, efficient, and affordable. However, it is not legal everywhere, and there are side effects, including smoke inhalation damage, dizziness, nausea, rapid heart rate, impaired reaction times, reduced concentration and memory functions, interactions with other medications, and this can create a mental dependency, although it does not create a physical dependency. This is definitely something that can be a contentious issue for some people, so this is very much a you do you kind of thing, but I would definitely recommend that you don't dismiss it right out of hand because it can greatly improve your quality of life. Before I was able to get help from the medical field, basically I was relying on cannabis, and I'm gonna be honest with you, this kept me alive. If I did not have access to marijuana, I would be dead by now. So it definitely should not be disregarded without seeing what it can offer you. Next one I want to talk about is diclofenac sodium 1% in a topical version. This could be a gel or a cream. That is the generic name. Its brand name is Voltaren Gel or Cataflam or Zipsor. This is available over the counter or via prescription and is covered by most insurance policies. It is an NSAID, which is a non-steroidal anti-inflammatory drug, and it is used mainly for joint pain. What it does is it inhibits the production of prostaglandins, which are neurotransmitters that regulate inflammation and blood flow. In the area it is applied, it will assist in reducing pain, swelling, and inflammation, although you should not use any more than 8 grams per day in any given area. Okay, you do not want to overdose on this. This will not really relieve the pain, at least not in my experience, or make it go away, I guess, really. Kind of imagine CRPS like a cold winter day, and diclofenac like a warm cup of cocoa. This is not going to make the weather any warmer, but it will help you tolerate it better. One more thing I want to add here that I'm not going to give a slide has to do with being able to ride in the car. If the car causes you pain, I definitely recommend investing in a quality shock absorber seat. You might be able to find actually a great one at your local medical appliance store or Craigslist. You could try to find a nice wheelchair cushion or something that is meant to absorb the vibrations so that your time in the car can be much more pleasant. The next method I would like to discuss is a 10% ketamine topical cream. There are several different kinds of percentages of ketamine topical creams out there, 0.5%, 1%, 2%. You're going to want to be on the higher end of this. Some pharmacies might be willing to go up to 20%, but that has not been studied and proven as safe, so you might only be able to get up to 10. 10% seems to be a pretty solid amount, though, at least in my experience. A compounded ketamine topical cream is only going to be created at compounding pharmacies, and you will absolutely need a prescription for this because it is a very controlled substance. It is often combined with other medications like gabapentin, ketoprofen, or lidocaine. This is unlikely to be covered by most insurance policies, but usually, if you're going to be paying out of pocket for it, it's usually about $1 a gram or right around there, and you'll probably need between 2 and 8 grams per day, depending on how much area you're covering, whether you do it twice a day or 4 times a day. It really just depends on you. The sole function of this cream is to force localized dissociation from pain sensation. Now, I am specifically talking about allodynia here. The studies show that there is a reduction in allodynia with the ketamine cream, but it does not really seem to affect when it's used topically, not when it's ingested. But when it is used topically, it does not seem to have too much of an effect on the burning nerve sensation pain, but it will definitely assist with the allodynia aspect. It does this by binding to receptors to prevent glutamate excitation of the neurons. I'll talk more about that on the next slide. Because this is not intravenous or ingested, You will not experience the negative side effects of ketamine, which I will talk more about on the next slide, which means you can utilize this when you are working, when you are driving, when you are interacting with people. You're not going to be experiencing the side effects that would inhibit your life. Now, there is one more thing I want to discuss here, because you might be thinking, yo, you're being hypocritical. Your whole shebang here is talking about integration and not dissociating, and here you are talking about a dissociative anesthetic. That's a fair argument, so I'm going to address it. Because dissociation is my stress response, I think that is why this medication works for me. Because it, on a physical level, medicinally dissociates me from that sensation so that I psychologically do not need to do that. I have been without this medication on occasion when there are snafus with getting it refilled, and I can tell you that I dissociate much more frequently when it is not being used. So, I don't really have any science to back that up. That's just my personal opinion, but that's kind of why I think it works for me. And then let's talk about the final one, intravenous ketamine. I was honestly pretty hesitant about deciding to put this in here, but I am going to, because I do not think I would have been able to get where I am now using all these other methods if I hadn't had the ketamine. It's possible that I could have, but that's not what happened, so I don't know. So I do want to include it here, even though it really isn't affordable. Intravenous ketamine absolutely needs a prescription, and you will likely get this from a pain management specialist. It is unlikely to be covered by most insurances in the US, and it is very expensive. Ketamine is a dissociative anesthetic that binds to NMDA receptors. What it's meant to do there is block glutamate from being able to use the receptors that it is in. So this means it blocks synaptic plasticity. Overactivation of NMDA receptors leads to excitotoxicity, which means basically that the neurons get so excited that they die or damage themselves. What ketamine does, in a very broad, basic sense, it basically resets brain connections, like rebooting a computer after it's gone wonky. You turn it off, turn it back on, and oh, suddenly it's working correctly. That's kind of similar to what ketamine does. And it allows the ketamine user to create new neural pathways and get out of the superhighways of pain that CRPS creates once it is in the sympathetically independent stage of pain. Many CRPS patients kind of have a toss-up with this, where some are like, oh yeah, it worked really, really well, and some are like, oh no, that didn't help me at all. It was just super expensive. It drained me. For it to be effective, you need multiple high-dose multi-hour sessions, and this is not for the faint-hearted. This is the most terrifying thing that I have ever done. Actually, during when I was going in for one of my sessions, I had to take my blood pressure before. I had a systolic blood pressure of 177. 180 is a hypertensive emergency, and you need to immediately be transported to the hospital because you're about to have a stroke. That's how afraid I was of doing it again, because it was so unpleasant. So what are some of the side effects of intravenous ketamine, especially at high doses? And the higher the dose, the more unpleasant it becomes. But also, the higher the dose, the more effective it is at relieving your pain. So there is definitely a trade-off here. Some of these side effects include hallucinations, confusion, blurred vision, nausea, vomiting, lack of muscle control, fatigue, difficulty speaking, slowed breathing, slowed heart rate, a floating sensation, falling down the K-hole, becoming the universe, being swallowed by the singularity, extreme terror, and ego death. The experience of high-dose ketamine like this, where you're basically in a ketamine coma, but not quite that intense, although that is also a method. I did not use that method, but I basically did one step below that. And it really shifts your perspective and changes you as a person. which is totally understandable if your ego is being dissolved over and over and over again. So this is definitely not a method that I recommend lightly, but it is also one where if there is nothing else for you to do, these are your options. It was definitely beneficial for me in the long term. However, actually going through it, highly, highly, highly unpleasant. And I'm glad that I did it, because it helped me set the groundwork for being able to use all these other methods and have them be effective. But I will probably try to avoid doing this in the future unless there is nothing left for me to do, because it was just so terrifying and expensive. This is probably something that's really going to put you back financially, but in some cases it might be worth it. That's really going to be something that depends on you. Even if I could have afforded to do the ketamine on a regular and continual basis, I probably would have chosen not to do so for this reason. I was concerned about the effects of constantly erasing the neural pathways I had created when the neural structures themselves were being attacked and degraded. On top of that, the ketamine was only truly pleasantly effective for me for about 2 weeks before it started to wear off. Week 3 was really rough, and then by the time week 4 would roll around, I would be actively preventing myself from committing suicide. So I was constantly spiking and dropping and spiking and dropping, and so I was unable to keep a steady behavioral response to it. So instead, I decided to go with the cheaper route that I hadn't even determined by the time I decided to stop the ketamine infusions, so that my pain would be higher but more consistent, so that my behavior could be reflective and also remain more consistent. But it turned out in my favor, actually, because basically what the ketamine was able to do, the ketamine infusions were able to do, was give me a clean slate to start with, and then I can use the rest of these treatments to maintain that without constantly erasing the work that I have done or draining my bank account. So you might be wondering what kind of results you can expect from utilizing this style of treatment. I only really have my own experiences to offer, so I want to put that out there for you. And so that we're all on the same page as to what kind of pain levels I'm talking about, I want to say I'm going to be using the Stanford University pain scale, where they put an average toothache at a 4, a severe non-migraine headache at a 6, an average migraine at a 7, childbirth at an 8, throat cancer at a 9, and a crushed hand at a 10. But I want to kind of merge this with the chronic pain scale, where additional numbers have been added above 10 to account for our ability to adapt and grow our pain tolerance levels. Before utilizing effective treatment, I lived at a 15, basically all the time, with very frequent spikes up to 17. During the 2 weeks that the ketamine was effective, that put me down to about a 4, which is the lowest I've been in years. But remember, I said it was a bit of a trade-off where I live a bit higher, but it's more consistent. So during this treatment, where I'm using these methods to maintain what the ketamine has offered me, right now I live at about a 7 all the time. Sometimes I'll occasionally spike up to an 8 or a 9 or a 10, but my base level right now is a 7. You can kind of apply that to what your own life is like, but I definitely encourage you to give it a shot, because I have found these methods to be effective, efficient, and affordable. So we talked about a lot of things today, and I just want to give you a quick general refresher of what we did here. We talked about self-discipline, acceptance, mindfulness meditation, fear paralysis, which becomes the moral reflex, leading into MNRI treatment, spinal cord and dorsal root ganglion stimulation, cerebrospinal fluid circulation, peristalsis stimulation, neurotransmitter re-education, aquatic therapy, heat therapy, stretching, desensitization, lymphatic massage, strength training, yoga, an anti-inflammatory diet, your nutrient levels of magnesium, B12, B9, vitamin C, vitamin D, and omega-3 fatty acids, LOPERAMIDE, CANNABIS, DICLOFENAC, topical ketamine, and ketamine infusions. Now that looks like a lot of things, but basically what this really comes down to is psychological integration, nervous system integration, musculoskeletal integration, and diet. If you can attack those multimodal approaches, you'll be better off than where you started. Thank you so much for watching, even if you don't agree with everything I said and maybe they don't all work for you. I hope you learned something here today and that it gave you something to think about. If you would like to contribute to my medical expenses fund, my Patreon is CRPS Contender. As always, relevant sources are linked in the description below. I hope to see you next time.